Welcome to Top 1260 KTRC, the Humanity Behind the Vanity. This is Dr. Daniel Ronel. I'm a plastic surgeon here with my wife Betsy.
And as you can hear, he has caught the latest cold running around Santa Fe, so pardon him. I got it and I'm getting over it.
Yeah.
But he's got it in the thick of it.
All right, and we're dressed like this for
Oh,
those
right.
of you watching us on
YouTube. This is our Halloween show, so happy Halloween, everybody. And we are Mr. and Mrs. Jonathan Hart. You remember that show? I'm Jennifer Hart, right? And we have Freeway, our dog, here. We would have brought Max, but we didn't want to have any issues, with his likeness or whatever, because we didn't pay for it.
Right.
But anyway, we're all blinged out, a little extra bling from Heart to Heart. So I had my ghetto nails on at the Espanola Valley event, and that was a lot of fun.
Yes, thank you for those who came to that.
Yes, all of you who came, who heard this on the radio, we really appreciate it. It was a very different event type this year for us, and it was a very new crowd to us. I think we got some new people interested in our little shelter, and we really, really need it and appreciate it. And we'd like to thank our sponsors, iFlow, the Pain Buster, and Artifil. And Artifil, I would also like to send a special thank you to them because they gave a $4,200 package away as one of the prizes that we used in our Espanola event this past weekend, the Hootenanny, and some very grateful man won it. And so we'd really like to thank them. So these guys don't only sponsor the radio show, but they sponsor us for the events that we attend, or the events that Dr. Ronel attends, so that people can win a piece of the pie.
Yes,
So,
yes, thank you.
All right, so what are we talking about, Sickie?
You wanted to talk about revisional surgery. Did you read some article in L?
In L, yeah, I think it was last month's L, and we've been meaning to talk about this for a couple of weeks, but just other things have come up.
Yeah.
So, yeah, it's about, not, I call it second chance surgery, but it's not. It's, what happens when you're not happy with, or the results aren't good enough, whatever, I guess it's the same thing, from the first surgery. And, it doesn't mean it's the doctor's fault, it's just these things happen. I have had some things revised by my own husband that he's done, and I just didn't like it, so he's done it again.
Across the board, about 25% of cosmetic procedures end up getting a revision.
Yes.
If you look nationwide, the three biggest ones are breast implantation, tummy tucks, and blepharoplasties.
Yeah, oh, bless, yeah, I can see that.
And
not nose jobs, huh?
Not so much, sometimes, but in my practice, everybody's different about how they handle it. In my practice, I usually don't charge, to revise it. I try to do everything in my office.
If it's a revision on his own work, he does not charge, right?
Right. If it's, and sometimes the patient might be asked to pay the OR and anesthesia fees if it has to be done in the operating room. But
so, what's it like? I mean, are patients upset? Are they angry? Are they nervous? Are they fine with it? I mean, I'm sure you get a range of all things.
Yeah, it can be really emotionally traumatic if somebody is unhappy with their plastic surgery. They usually have extended themselves to pay for it, and they have a specific time frame to recover.
Right,
and now if they have to get something else, it can be quite traumatic to them. And at the preoperative consultation, I go over this just to make sure that they're at least aware that it could happen. Having said that, most people understand that I cut and God heals is my favorite one.
Right, can I just interrupt for 1 second? Because I love to do it.
Okay.
This is another reason we do this show, is because, this is what happened to me. I thought, okay, I get a breast lift, I get an implant, I'm going to walk out looking fabulous and have no issues, no problems, no nothing. I didn't even know about revisions. And I'm the wife of a plastic surgeon, for goodness sake. I didn't even know about these things. But that's because I've watched all these shows. And I'm not disparaging the shows. I love the shows. I look forward to them every season. But it's because none of them have shown the realities of it. So that's really was our big motivator for this show, is to talk about real situations in plastic surgery, one of which is revisions. They are quite common.
And most plastic surgeons have a good heart, and they try their best, and they want their patients to look good, and stuff happens.
Right, life happens. I have one breast that healed differently from the other. Who knew? They looked good when I came out of the OR.
So this is a realistic thing to understand that revisional surgery may be required. Just to answer your question, like I said, most people who do require a revision, they kind of understand, why it happened. They're grateful for a doctor who can not abandon them and care for them. I see some patients who really are abandoned by their surgeons when they have a problem, and I just think that's a crime.
Right, that happens. And just because you need a revision, people, it doesn't mean you had a bad surgeon. Yes, there are bad plastic surgeons out there. We hear about those all the time.
But there are a few.
Right, they're not right. Those are just the examples we hear about. We always hear about the squeaky wheel.
Yeah.
So, I would just say that, shop around wisely for your plastic surgeon. If you gel with one, go with that one. If you thought, oh, this is the best one, it's got to be great, and you're just not clicking with that surgeon, don't go with them. I don't care what their reputation is, just don't go with them.
And ask them about their policy for revisions.
Yeah, do that too, because it can happen. I mean, a body is an organic thing. There's no guarantee on that body, whatever it's going to do. The two sides are not equal. And you're also dealing with a human being, which is an organic thing on the other end, who's operating on this other organic thing. Whatever, I'm not making any sense, but it's nature here. This isn't a chemistry lab. This isn't a manufacturing plant. This is one human dealing with another human, and there's no perfect answer a lot of the time. But, 75% of the time, everything is flawless and there are no problems. But here I am, the wife of a plastic surgeon, and I needed a couple of small revisions. Ain't no thing, I just went and got them. But it happens, and I've heard people get very alarmed, not from my husband, but just in general, that, I had my boobs done, they didn't come out right, and, I'm furious, I'm going to sue the doctor. Come on, get over it. It happens all the time. I'm so tired of people suing everybody for breaking their fingernail on a countertop. Goodness. Anyway, so yeah, shop with confidence, shop with comfort when you're talking to a plastic surgeon.
Be informed.
Be very informed. Educate yourself. There's so much available online. Right. And no question is a dumb question. And feel entitled to an answer when you walk into a doctor's office. You're paying. You deserve it. It's your health.
Right. There's another thing I want to mention, because we're in New Mexico, I get a lot of revisions from Mexico.
Right.
And there are some fantastic plastic surgeons in Mexico. However, there are some chop shops there.
But the good plastic surgeons probably charge accordingly. If the price looks too good, it's too good to be true. Okay, so go on.
And so some of the patients don't want to go back there because they don't feel comfortable, or it's just too dangerous. In Juarez right now, you can't be a tourist.
Juarez.
Yeah. Sorry, Juarez is in Peru.
Oh my God. He definitely has a cold. Okay.
Yeah, so anyway,
I mean, seriously, I knew someone who got her breasts done there. She had implants put in. She showed them to me. I saw the whole thing popping right out of the incisions. It was nasty as a young girl. And I said, nothing's FDA approved down there. You don't know if that's a balloon full of, pudding.
Actually, I helped her and I got the implant out and I sent it into the manufacturer, and they said this was not made by us in the United States.
Good. They got knockoff implants down there.
Yeah, it's very scary.
Again, this is by the disreputable plastic surgeons. Right. So people, if they're saying, I'm going to charge you, $1,500 to do your breasts, that is too good to be true. Right. Exactly. And you're going to get a balloon full of pudding. Okay?
True. Really the worst are the big abdominoplasty infections that I see from there.
Also fillers. I mean, they're filling you up with, Vaseline.
Yeah, they call it Artifil, but it's not Artifil.
Goodness. I mean, that is just a crime.
Silicone.
And you go put that, look at poor, who is it, Lisa Marie Presley, the wife of Elvis, that gorgeous creature. It's not her fault. And I'm not saying it's the doctor she went to's fault either. She had silicone injections put in, and it didn't work for her. And now her face is paralyzed. She's working with reconstructive surgeons to get it out.
Right.
But this can happen from in the United States, and experiencing the United States, even from a woman who could afford to pay top dollar. I don't know what she went through. I don't know if she paid top dollar. I don't know what happened. And I don't know the surgeon. It was probably a fine surgeon. But these accidents can happen even in the top tier of things. Imagine what can go wrong with your bag of pudding.
Right. Okay, we got to wrap things up. Coming up is a chiropractic tip from Bobby Perea.
Yes,
we'll be right back.
All right.